Hello and welcome to this episode of CQC Connect, the podcast from the Care Quality Commission. CQC has an ambition to be a world-class regulator, driving improvements in how people experience health and care services and working towards a safer future. To help achieve this vision, we are developing a new strategy to start from 2021 that builds on the work we've done previously and takes us forward. My name is Sam Wallace, Provider Engagement Lead here at CQC, and today I'm joined by a guest to discuss one of the themes of our new strategy, promoting safe care for people. To start off, I'm going to ask my guests to introduce themselves.
Hello, I'm Anna Edwards. I work in the strategy team at CQC, and I'm currently working on patient safety, which I've done for about 2 or 3 years now in various different guises.
Great, thanks Anna, and thanks for joining us today to talk about our new strategy. Could we start off with getting a bit more information about this theme, what it's looking at, and some of the questions it's trying to answer?
Sure. So patient safety is a really key element when it comes to quality in any health and social care setting. And so it's really crucial that we support improvement here, as it is consistently the poorest area of performance in our assessments. There's always a lot of work happening in patient safety, so it's also important for us to identify where we as the regulator can really add value. Some of the early thinking on this theme, I'll divide it up into 4 different things. The first is that we think we need to know what we mean by safety across all sectors. And when we talk about safety, we should have a really consistent understanding of the different elements. So championing a clear definition and language is key. We can do this using our assessment frameworks and hopefully start a movement across all of our strategic partners to get clarity and certainty for everyone working in health and social care. The second point is that we think we need to be much tougher on patient safety cultures. Again, for us, this is about being clear on what we mean and what we're looking for, but we should also be much more proactive rather than wait for things to go wrong. So what that means is that where the culture is toxic and fails to promote transparency, learning and reporting, and perhaps where it's not restorative in nature, we need to be able to identify this, measure it and act on it. The third thing that we think we need to look at in this theme is, we know there is national patient safety oversight for NHS trusts with the National Patient Safety Team over at NHS Improvement. But COVID taught us that this doesn't exist in other parts of the system, and they therefore got left behind during the height of the pandemic. And so we're really interested in looking at the solutions to this, given our unique position as a regulator. And we think we may be in a good place to support thinking around greater oversight across all sectors and systems as they emerge. And finally, we think patient safety needs to be about everyone, from board through to patients receiving care. Patients need to play a key role in their own safety and the safety culture in their health and care services. So CQC really needs to think about how we can best promote that.
Thanks, Anna. That's really interesting. And this sounds like there's some really important stuff in there for us. It'd be really good to understand a bit more then about why we think this is a really important theme for our strategy. Why is this one of the themes that we've chosen to take forward and explore in more detail?
Sure. Well, patient safety as a concept has made great progress since the publication of To Err is Human 20 years ago. But we think there's much more that we and others need to do. So we all need to know much more about behaviour, systems, leadership and culture. And we know that people fear blame and close ranks, and therefore they lose sight sometimes of the need to improve. However, we think that we need to empower people with the skills, confidence and mechanisms to improve safety. The patient safety strategy, the NHS patient safety strategy, says that in the NHS alone, this could save 1,000 extra lives and £100 million in care costs each year from 2023 to 24. and that there's the potential to reduce claims provision by around 750 million per year by 2025. But there are also the implications for people. If we work much harder to improve patient safety across the system, it could mean that people have less bed days, they avoid further surgery, they avoid psychological damage, pain, suffering and fear. There's also human rights abuses to consider and the risks that CQC have identified in closed cultures.
So it'd be really interesting to hear about what we think success looks like in terms of delivering this theme. So if we think about in 1 year or in 3 years or in 5 years' time, what would we like to see or have achieved if we do this well?
Sure. Well, if we implement our work here, we should have a much clearer understanding of safety and safety cultures. Providers should know what is expected and be supported to harness strong leadership and patient safety cultures in all settings. I think where providers continue to have environments in which there is blame, fear, and hierarchies are alive and well, and where avoidable harm continues with no real learning as a result of it, we're going to proactively intervene much earlier and take action. I think at CQC, maybe we've often been afraid to act on culture due to its intangible nature, maybe with difficulties in proving what we see. But going forward, I think providers and people using services are going to see us being much bolder. And then in terms of people using services, well, they will rightly have much higher expectations when they enter a service, not expecting to be harmed, but working in the belief that they can and will play a part in their own safety, even where that might create a risk.
Thanks, Anna. And I think that message about culture being really important and some of the work we can do around that is a really, really good point to make. I'd be really interested next to hear about how we're planning to develop this theme going forward. What are the questions we still need to answer? What are the things we need to work through as we take it towards our final strategy?
So there's lots of questions we need to answer and things we need to work through, but I suppose I'll pick out a couple. So firstly, I think we need to just unpick what our role is, what's the role of others, and understand where there might be gaps. We as the regulator might need to call out these gaps. We might even need to fill them. And if that's the case, we're going to have to think through the kind of benefits and risks and implications of any action that we take. We're also going to have to think really hard with our strategic partners to add clarity on what we mean by patient safety culture. You know, so much has been written about it, but I think what's missing is what it means in practice on the ground. And then for us at CQC, how this is going to translate to our assessment frameworks.
Thanks, Anna. And that's, I think that thing about working in partnership with others is going to be really important. I mean, not only for this theme, but for the entire strategy going forward. Thanks again for joining us to give us a bit of an introduction to this theme, promoting safe care for people, and telling us a bit more about the work we're doing. And thanks for everyone for listening to this podcast episode. There are more episodes on our the other themes of our developing strategy that you can check out now. And look out for other podcasts on other topics coming soon.